Hey, this is Anastasia with Hump Day Happenings. The question this week was asking about oral sex, oral cancer, are they related, and what can you do about it? Well, yes, they are related through HPV. That's the human papillomavirus virus. And it's transmitted through direct contact. You see, some think that oral sex is safe sex because you can't get pregnant from it. Let me throw a statistic out to you. HPV is responsible for 39% of oral cancers. That's pretty high if you consider the other risk factors for oral cancer being smoking, alcohol, and a family history. So I'm going to ask you, do you think that's safe? What can you do about it? You need to know the symptoms, apply a little common sense, and you need to ask your dental professional what we can do because it's all about prevention. So what are some symptoms? You've got to know your mouth. So do you have a sore that won't heal? Have you noticed a red area or a white area won't go away in about 7 to 14 days? Go in and see your dental professional. Have you noticed in the back of your throat maybe prolonged hoarseness, a lump in your throat, difficulty swallowing? Common sense. It's not that common, but you've really got to know your lifestyle. So if you've had more than 5 partners, you're at an increased risk for not only contracting HPV, but then of course, if you're stressed out, decreased immune system, and you have that virus, it could be opportunistic and form into oral cancer. Other lifestyle choices could place you at 17 times the risk for both contracting HPV, again, applying other health conditions or ailments, and relating that into oral cancer. So you really need to know your lifestyle, your health, and make wise choices. I encourage you, start a communication open with your teenagers or your partner. It may seem uncomfortable at first. However, remember that statistic. You've got to protect yourself. Finally, how can we as dental professionals help you with oral cancer screenings? We've got the coolest stuff out there. We've got lights that can detect abnormal tissue, brushes that help us find out, is it a precancerous lesion or is it not a precancerous lesion? If it is, what stage is it at? Finally, we're going to have tests that will detect whether HPV is in your saliva. It's oral DNA. That's pretty cool. So I hope this helped you out in identifying, yes, it's not safe sex. It's also something that you consider knowing the symptoms, common sense, and asking your dental professional. Now, I need your help. Go to Hump Day Happenings for next week. Ask me an oral health related question. Till then, take what you learn and make a difference with it.